This is one of the latest studies that we have done within the New York State MS Consortium. And we previously have looked at different aspects of what are the long-term factors that drive disability progression in multiple sclerosis. In this particular study, we really focused on the effect of therapy and whether the patient stays on therapy for the period of their disease or discontinues their therapy, and how that discontinuation will actually affect the long-term outcomes, progressing to using a cane or a wheelchair and transitioning to secondary progressive MS. So in this study, we utilized 1,893 patients with multiple sclerosis with an average age of 43 years old and a typical demographic characteristics of the MS population. The baseline EDSS was 3.0, and we followed those people on average for 6.9 years. However, within that sample of almost 2,000 patients, there were patients who were followed up to 20, 30 years or more. So there are several findings that popped up during the analysis. The first findings were something that we already expected and we confirmed that are true. And that being said is the male sex, older age at baseline, and also higher disability at baseline were all factors that led to higher disability later on as the patients were followed. What we really were looking to find for the DMT actually surprised us in two ways. The first surprise in the study was that patients who have never been treated with any DMT throughout their disease had the best outcomes in the study. And this is a little bit different than what we expected from the DMTs. However, when we looked at the data a little bit more carefully, we saw that those patients were actually those who did not usually need therapy in the first place, and so-called benign cases, and therefore they turned out to be the best. When we look at the patients who did require therapy and compare the patients who had discontinued their therapy versus those who have continuously remained on therapy, this is where we found our main finding, that people with multiple sclerosis that have started but stopped using therapy over the follow-up period have reached faster and have reached more often long-term disability milestones like EDSS of 4.0, like EDSS 6.0, and they have transitioned more often to a secondary progressive phase of the disease. The second aspect of the study that we also were very interested to look into is the patient-reported outcomes and how would a subjective explanation of your well-being can explain the trajectories of your disability. And in people with multiple sclerosis, people who have reported they feel worse at baseline tended up to have more disability progression over the follow-up compared to those who reported that subjectively feel better. And this is further confirming the utility and the usefulness of patient-reported outcomes, and that we should measure the subjective feeling of well-being.